Hello, let's talk about artificial teeth or false teeth. As we have seen earlier, there are two main classifications for artificial teeth. One is removable teeth and the other is fixed teeth. Removable option we have seen earlier in our video. Now let's move to fixed option. So, new fixed teeth can be either in the form of a bridge or implants. Dental bridges are false teeth held in place by the teeth around your missing tooth. They are usually made up of materials like porcelain to match your tooth color. Dental implants are artificial tooth roots usually made from titanium. They are placed into your jawbone with screws to hold crown or bridge in place. Now you may think which one is better, an implant or a dental bridge? So let me tell you, let your dentist decide which one is a better option for you. Though implants have significantly higher success rate compared to bridges and have many advantages like they prevent bone loss and they resemble natural teeth also. But there are certain disadvantages too in cases of implants. So going to the drawbacks of implants, first of all, they are expensive. They are contraindicated in case of uncontrolled diabetes. They are also not advisable for heavy chewers in which the masticatory forces are very high and they cause multiple visits for the patient. But the good thing about implant is implants can last for many years or even a lifetime if properly taken care, and they can easily adjust with the adjacent teeth as compared to the bridges. Bridges deteriorate the health of adjacent teeth. Implants from preparation to final stage may seem more costlier, but over a period of time, this is cost effective. Moreover, replacing the missing tooth with a dental implant is the one and only way to prevent bone resorption. And it helps to grow the bone back to its normal position. Now let's talk about dental bridges. They are an affordable or an economic option as compared to dental implants. Moreover, no surgery is required in cases of dental bridges. Now looking at the drawbacks of dental bridges, bridges sit above the gum line, so the jawbone will continue to deteriorate. It will cause bone resorption, and the next thing, bridges are not as long lasting as dental implants. So your dentist may decide to go for a bridge if you are having uncontrolled diabetes or if you are a heavy masticatory chewer. Otherwise, implant is the best option for fixed teeth. All the best. Goodbye. See you in my next video.